Hello people, if it's the first time you're seeing this face on this channel, a big welcome to you. And if you've come over from natural Gambia, thank you, you're welcome. Let me introduce myself. My name is Rita. I'm a clinical researcher here in the UK. And guess who's joining me soon? Hey, my people, jackpot time. I have so much to tell you today, like loads. I'm sure you know stranger to the new announcement from the UK government. Health and care worker visa will be opening up. All right, they're opening it up to overseas workers, care workers, home carers, support workers, the usual nurses, the usual doctors. You're all welcome. One of the benefits you should remember is the health and immigration surcharge of £624. You will need to pay it. It'll be waived because you work in the sector. All right. So with this visa, visa we're talking about, the health and care worker visa, you won't need to pay that surcharge. So that's a great benefit. Now we hear that by February 15th, write that date down. Really important. February 15th, 2022, the doors will be open. And my people can come in. Like seriously, I hope you're prepping up. There's so much information out there right now. What I'm going to try and do for you on this channel is we're just going to keep it simple, okay? I get all the facts I can from you. We're on ground, so we'll check for you. Don't worry, we'll do that. Tell you what you have to do. Get you prepped, get you ready, get you applying, because you need to apply. If you don't apply, how will you enter? So now it seems like all you guys have to do is listen very carefully, be safe, because there'll be all sorts of conflicting information out there, and you know now, opportunity for scams. So please be safe. Don't say Rita said, oh, I did not say, oh. Check and check again. When you hear from the other channel, you hear from that other channel, you hear from my channel, just check. But I'll do my best for you here. I will get what I can get for you. As current as it is, I'll let you know. So you can apply. That is true. The care homes are recruiting. The agencies are recruiting. The only thing is that you've got to know what their requirements are, because they're different requirements. So let's go straight to the basics. All right. What is this healthcare and care worker visa? It's a new addition. They're amending what they had before. There's a skills shortage in the UK for care workers. So what the government wants to do is to make sure that they can have enough people to work for them in this sector of the economy, and they don't have a dangerous shortage, because we are low on care workers. So they've added that to the list of shortage skills, so you guys can do your bit and apply and come in. All right, it's straightforward. You don't need anyone to do it for you, actually, to be honest. All we can do is guide you. If you want to use an agent, that's entirely up to you. I'm not here to tell you not to. But what I'll do for you is to give you as much information as you need to be able to do it for yourself. So what are your requirements? Basically, you've got to have an offer from one of the approved organizations that offer care. So the number one in this country will be the NHS. So obviously, if you get a job from them, well done. If you get one from one that provides care, to, or workers to the NHS, or services to the NHS, an organization that fits that, that's number two. Number three, those that provide adult and social care services as well. That will be the third one. So there are quite a few of them in England, in Wales, Northern Ireland. There are loads in Scotland as well. So don't worry, the jobs are there. The only thing you need to find out is, do you fit into any of these ones? And truthfully, you don't actually need a formal qualification, and that is true. It's just that the only caveat is that for now, it hasn't been fine-tuned yet. It's still a teething problem. The government is yet to do that great announcement on February 15th. So just stick with it. Start doing your prep work now. One of the things I want to remind you, for a few of you have asked, it might not be written anywhere, but do you know that you have to be fully vaccinated? Please. And remember, you've got some time. You take the first one, and then after about 8 weeks, the next one, to make you safe. So if you ask me, if you haven't even started with the first, this is your time. Time is running. Could you please go and at least get one? So that even if you have to do the second job when you come in, at least you've done one. Because don't forget, not only are you getting the visa to come in, you have to actually pass the immigration requirements to leave your home country, to enter this country. So this thing is open to overseas. I'm not just talking to our Nigerian brothers and sisters. I'm talking to the whole of Africa. I'm talking to outside of Africa. So as you come to this channel and you watch, what I can promise you is that to a large extent, I will do your running around for you. I will not enter you and travel anywhere for you. That's not what I said. You've got a care home, you've got an area you're interested in, you've got an agency you're interested in. I will do the calls for you, no problem. I have credits, don't worry. I can make those phone calls for you and I will let you know what they say. I've done some, so in my next, because I don't want to make this video too long, but in my next, my upcoming videos, what I'll do is we'll take batches, we'll take names, we'll ring them up and we'll get the information to you, all right, so that you know where to go. Are they giving you a sponsorship line? They're giving you a sponsorship certificate or not? So clearly you need to make sure that you have the requirements to be able to come to this place and work as a care worker. So if at this point you like what you're hearing, just hit the like button, okay? Subscribe, notification bell. Promise you I've got lots to tell you. I'm just trying to break it down so that I don't overburden each video, but I've got lots of information and we're going to do something differently on this channel. We are going to go away with some assignments. I am actually. You're going to let me know what you need help with and I will do my best to do that for you. The one I can assure you I can do now before you ask is that we'll be ringing some of your care homes and actually asking them these questions for you. So I can do that one for you. If you like the sound of that, please support my baby channel. It's a baby channel, like brand new, spanking new. I don't have any subscribers. Come on, guys. Subscribe, please. All right. Thank you so much. So your sponsorship certificate has to come from your employer. So when they give you that job, that's the number one thing you will need. You will have this special reference code on it. It's electronic. That's what you use to fill your form. All right. You need things like your financial requirements. All right. You have to have some money in your account, about 1,200 thereabouts pounds, which give or take for most of you will be less than £1 million naira. Far less than £1 million naira, actually. Like just above £500,000 naira thereabouts is what you should definitely have had in your account for minimum 28 days, but to be safe, 3 months is what we usually say to you. 3 months. If you have a 6-month bank statement, even better, because that shows that you have an account you're running. You're not going to come here and you know now. You have to be able to take care of yourself to a large extent, or your sponsor is able to sponsor you for that, because some employers will do that for you. They will be able to make sure that you have your maintenance and they can prove that. That is allowed as well, all right? So just make sure you have things like that. Your English language. Have you got proof of English language? For most of the majority English-speaking countries, example, Nigeria is actually, it is your official language, English language. But the thing is, you've got to have a degree, a certification, something, a qualification, usually from the BA level, so the Bachelor's of Arts, Bachelor of Science, from that degree level upwards is what they want. So your master's and of course your PhD. If you are a qualified doctor, a qualified nurse, a qualified, both of them actually, a midwife, that's the third one. Your registration, your NMC, your GMC, or whatever it is that you've got, or the equivalent in your home country, will suffice for that. So that is acceptable. So you can use that as proof. And if you're not into the science bit, you're not qualified a medical professional, you got your BA in whatever, communications, arts, or whatever it is, you can equally get that. The only thing is that you make sure you go to the certifications. That there will be, I'll put that in the link actually for you. So the NARIC will check that out for you. Just check that yours is acceptable. It usually is, because when I came here some kukuruku years ago, basically I did not, I'm also medical, everything medical I did here in this country. So my history is from communication. That's where I came from. And then banking. So by the time I was coming, I came in with my BA, I believe it was a BA then, mass communication is what I had, and that was acceptable. To be fair, I didn't come direct as a care worker. That didn't exist those days, but I came in for my studies, I came in for my master's, but that was acceptable because clearly, with majority speaking, it is taught in the English language. That is the key thing actually. So your transcript and everything, that study, that level of study was taught in the English language in your home country. So if you have something like that, which I would argue that most of you do, you've already met that one. The only thing is that you make sure that you get like it will be probably a certificate to say yes, this is approved by NARIC, that yes, this is actually this is acceptable and you're eligible on that front. Okay, every other thing is just basically the immigration things. You will pay the fee. I believe it might be so 3 years and under might be 232 if I'm not mistaken. I'll find out for you. I have it scribbled out somewhere. I think it's 232, and then for your anything more than 3 years visa will be 464. That's pounds, in pounds. So I would also argue that you'd be able to save that up by now, or at least have that in savings somewhere. So it's not heavy. You can come in with your dependents. Your dependents being, of course, if you think about a nuclear family, daddy, mommy, children sort of thing. So all your aged parents who you can prove that you've been caring for quite a while. There are different requirements. Everybody's situation will be different. So you might need to speak to an immigration officer, which I am not. I am not one. So they will explain to you how best to come. If you've got dependents that you're coming in with, they will explain to you what your situation is. You can come with them. So that this particular one is actually so much better than most of the others. It's obviously cheaper and faster than the skilled route. So for the visa for skilled workers, it takes about 8 to 12 weeks for them to process your visa. This one, this healthcare worker, care worker visa, it's fast-tracked. 3 weeks. 3 weeks as compared to 8 to 12 weeks. So you're starting to see the advantages there. And of course, because that is specifically for the healthcare industry, the surcharge, the NHS surcharge that you're supposed to pay will be waived for you. It's cheaper, the processing fee is cheaper. What's not to like, eh? So my own is, get ready to apply. By February 15th, we're going to know more. There's a code we are hoping is going to come up when that announcement, that adjustment comes on February 15th. We're hoping, because that's what we're all looking for. We're looking for the code 6145. You heard it here first. 6145. And that is going to cover you guys. Guys, have you subscribed? Can you see that my channel is a new one? Just press it, please. Jojo, please. Press subscribe button. Press the like button. Press notification button so that when I come back, you know I'm on board and I've come to give you information. I'm not going to mess you about. Don't worry. We'll play. I can play. I didn't play finish when I was small, so I'm going to play. I will make noise. I will play. But what you'll be leaving with every time you see my face is information. Okay? And I am qualified, so you can ask me questions you want. All right? So like I said, as I know, I will let you know. Right? Trust me. So I'll see you on the next one, right? But subscribe.